Welcome to Cura Talks, a podcast by Cura Health that brings you thoughtful conversations with healthcare professionals across Kuwait. From wellness myths to modern medicine, each episode gives you the insight and clarity you need to better understand your health and your choices. Today's episode is a really important one. We're joined by Dr. Razan Rahimi, a specialist in emergency medicine, to help us navigate some of the concerns people have been experiencing lately and to break things down in a way that feels clear, grounded, and reassuring. This conversation is all about understanding what matters, what doesn't, and how to respond in a calm and informed way. Dr. Razan, welcome to the show.
Thanks for having me.
We're very lucky to have you here. So, you are an emergency medicine specialist.
Yes.
The closest thing I know to emergency medicine is what we've seen on Grey's Anatomy.
Yeah.
So can you tell us what life is like in the ER and what you do?
Okay, so it's not like Grey's Anatomy. We barely have time to meet other people, let alone date. Life is interesting. It's interesting. It's very fast paced. We see a range of different things, from someone who has the flu to someone who's having the worst day of their life. So there's always something new to do, and there's always something interesting and lots of stories to tell.
Interesting.
Yeah.
So in these uncertain times,
Yeah.
how do we stay prepared? I'm trying to make this conversation something that is very practical for people to be able to have a toolkit, let's say, to navigate these times. In your opinion, how shall we stay prepared?
Well, I like the idea of 72-hour bag. So I advise all people to do that. Maybe some people who are like doomsdayers, people, they may know about this. So 72-hour bag is something you prepare that if you are unhoused or something's happened and you need to leave where you're living for 72 hours, you have a bunch of things ready. So that includes water, non-perishable food that will keep you for 72 hours, clothing, prescription meds, very important, especially if you have elderly or kids or people with chronic diseases. Prescription meds for at least 72 hours, and a little tiny first aid kit. Batteries, solar power charger, and that will be your 72-hour bag in case anything goes wrong.
Interesting.
You got all the stuff. Yeah.
And then, given the panic, let's say, how do we separate that from social media fear that's sometimes irrational?
Well, I think it's really important to look at the facts and the reality of what's happening rather than looking at tons of social media posts. So I think it's really important to differentiate between what are facts and what's just social media panic. So take your information from your reputable sources. Take into account that we're super, super privileged to be in Kuwait. We're quite safe.
Indeed.
Everyone's been doing such a fantastic job of keeping us safe. Yes, there are bombs. Yes, it's stressful. Yes, it's uncertain. But realistically, we've got food, we've got shelter, we've got electricity. Life is actually going on as normal with a side of anxiety.
Yeah. So then how do you stay aware without overwhelming yourself?
I think it's really important to set a time. If you want to be informed of the news, instead of scrolling all day or between meetings or between doing something and picking up your kid, you're scrolling the news. Set a time throughout the day where you can go to the governmental sources, the public sources, get the information, the updates, and then just forget about it for the rest of the day. Focus on being present with yourself, with your job, with your family, grounding. That way, you're giving your brain a set time where it's allowed to panic.
Right.
And then the rest of the day goes on as normal.
Right.
Yeah.
Okay, moving on to, pinpoint the elephant in the room.
Yeah.
Nuclear fears. How realistic do you think these fears are?
Now, I'm not a political expert or an environmental expert, but I can talk about the medical side effects of if there were a nuclear bomb. like we have a section of emergency medicine that's called disaster medicine, and that's focused on like environmental emergencies, things like nuclear disasters. So we have something called the hot zone, the warm zone, and the cold zone, where if you do have a nuclear disaster, like the warm zone is a section where you're going to get the most effect. The hot zone is like where you would get the most effect. And then it's the warm, and then it's the cold zone where the distance is far enough where the people who are in the cold zone are not going to get immediate radiation sickness. We are 700 plus kilometers away from, like, the closest nuclear plant is the Bushehr plant. And we are 700 kilometers plus away from that. So let's hypothetically say that it explodes. We are way, way further from what would be considered an area that would cause immediate harm to the people around it. So a, a nuclear blast up to like 50 kilometers, that would be considered like a hot zone.
Okay.
And within the first like 24 to 48 hours, that zone really shrinks in size because like the radioisotopes just kind of disintegrate over time. So because we're 700 kilometers plus, none of us are gonna get any immediate radiation sickness from that explosion.
What is radiation sickness?
So radiation sickness, there's a bunch of different types of radiation sickness. The initial one is if you're like in the hot zone and you're exposed to a very high dose of like a nuclear radiation, there's something that would cause immediate death. And then there are ones where you have immediate symptoms, but may not lead to immediate death. And it presents like a really bad skin burn, shortness of breath, difficulty breathing, fever, things like that. So that's like the immediate syndrome. It's like being in a major explosion with severe burns over the body. And then there's the delayed symptoms where you may be exposed to a smaller dose of radiation. Say you were in like a zone that was warm or cold and you were exposed to a specific amount of radiation that wasn't that large, then you would have delayed symptoms. So diarrhea, vomiting, sometimes something called pancytopenia or lymphocytopenia, where your blood cells, like your immune system starts to drop, your bone marrow is incapable of making new blood cells. And then you've got the long-term risks, obviously, which happen over years if you're exposed to small doses of radiation, which is increased long-term risk of cancers, especially thyroid cancer.
Okay.
Yeah.
So in terms of supplementing with something like potassium iodide or iodine, what should the public know? I know Kuwait is very well prepared with that. And there are risks in taking this preemptively. So can you talk to us about that?
Yeah. So potassium iodide supplementation is not something that you should do in preparation for a nuclear disaster. If you're taking potassium iodide on a daily basis, you're running a serious risk of hypothyroidism, so messing up your thyroid hormones, and it can have side effects. You can get allergies to it, and there are certain medical conditions where you shouldn't be taking potassium iodide at large doses in general. It's only given if you have been exposed to radiation. And the key point is maybe people might have like a wrong idea about what potassium iodide does. It doesn't prevent radiation sickness. It's just a normal type of iodide that your thyroid gland uptakes. And that prevents you getting exposed to iodine radiation. So prevents risk of thyroid cancer and damage to your thyroid cells. But it doesn't prevent radiation sickness in general. And it's given at a specific dose and should only be taken if you are informed by the Ministry of Health that you have been exposed to radiation or this section of the community has been exposed to radiation, and we suggest that everyone gets supplemented by potassium iodide. Otherwise, don't take it.
In terms of water contamination, what is the real risk versus the exaggerated
social media risk? Well, the real risk is that the water can get contaminated if that nuclear power plant explodes. But like I said, there's the warm, hot, cold zone. So the amount of radiation that we will be exposed to will be much smaller. And because we're downstream to that, that will kind of affect the Gulf region. And it runs the risk of like long-term cancers if we consume that water. So it's more a danger of us losing our water resource rather than us getting radiation sickness more than anything else.
Okay.
Yeah.
Okay, moving on to real life situations.
Yeah.
So if in an emergency situation you're outdoors or in the car, what should we do?
So in the car, there's this rule of you're in the car, you don't want to be in the car. So if there's a blast injury, when you're in an enclosed space, you run the risk of like much more damage than when you're in the outdoor space. So if you hear the sirens and you're in the car and you're outdoors, if there's a shelter next to you, then you want to seek shelter in a closed building or something that has like heavy shelter that has a basement. If you don't have that option, then you just park the car on the side. You can get out of the car. And if there is an immediate blast injury like close to you, the best thing is to crouch and protect your head, kind of get into like a fetal position on the floor as low as possible. Because the major risk is like you get hit by other things rather than from the blast itself.
Right.
Just protect your head.
What do you do in the first few minutes?
If you're in like a blast injury,
Yeah.
it really depends on how close you are. So I think we're pretty far away from most of the events that are happening. Let's say you are in close proximity. I always say it's very important to have a leader. So leaders kind of run the thing. So you need to have someone who runs the show and delegates tasks. And the most important thing is to make sure that you are safe, the scene is safe, call emergency services, and keep everyone away from the areas that they could like be harmed at. And that's basically it.
How do you tell the difference between panic symptoms and actual physical symptoms?
It's actually really difficult to like differentiate because a lot of symptoms of like a panic attack or an anxiety attack are similar to the symptoms of like a heart attack. And people genuinely feel that, like they genuinely feel like their heart is going to stop. So a trick you could use is if you do feel those symptoms, you could try something called like the 4-7-8 breath, where you take a breath for 4 counts, you hold it for 7 counts, and then you exhale for 8 counts. Take a couple of deep breaths. If you start feeling better, it's more likely to be a panic attack. But I still would recommend that you eventually head to the ER if you have any chest pain, if you feel short of breath, if you have this feeling of impending sense of doom and you're sweaty. If you feel better, that should make you feel a bit better that it's not something serious, but still eventually head to the ER to be assessed by a physician.
Interesting. Talking about home preparedness, if you have, let's say, the elderly, how do you prepare in such situations?
So elderly people have like a lot of they need extra special care. They're a very vulnerable population. Currently, I would suggest people keep a 3-month stock of prescription meds for the elderly. Because if you get like a blockade and things don't come through, one of the major things that we tend to lack are prescription medications. So if you have any elderly people at home or anyone with chronic diseases, make sure you have a stock of your prescription meds. If elderly people show any symptoms that are concerning, chest pain, shortness of breath, just general fatigue, you feel like you're talking to them, but they're not there. There's something off the baseline. Those are like situations where you would want to seek care to make sure that they're doing well.
I think in these situations, some of the most vulnerable would definitely be the kids.
Yeah.
And how we react around them is not always within our control, let's say.
I agree.
What would you recommend in these situations? How do we deal in times of crisis around children?
I think kids, they tend to mirror your nervous system. So if they look at the parents and their caregivers, And if they see you or they feel that you're panicking, they will start panicking. And if you're calm, they will realize, oh, this is not scary. I don't need to panic. I don't need to, like, I can be calm. So it's important to, like, when you hear the sirens, try to center yourself. Realize that the reality of what you can actually do is to stay safe in your home. And that you're most likely very far away from a bombing or possibility of danger. And to center yourself, you could do the 4-7-8 breath.
Mm-hmm.
That would keep you calm. And that would keep your child calm on the side as well.
We've also been hearing a lot about the risk of power outages.
Yeah.
We're also heading to summer.
Yes.
How do we deal with, or what should we know about heat exhaustion and mitigating the risks?
Okay. So heat exhaustion, we already talked about the elderly. So other than the elderly, children are the most vulnerable population. So when you're in extreme heat, babies and elderly people can't really manage their body temperature in the same way that young, healthy people would. So you need to make sure that you're keeping them cool. If you happen to have a generator that can run your AC, that would be great. It really depends on how long the power outage would go.
Yeah.
But let's assume it's going to go for a really long time and it's middle of summer. Your best bet would be to get water on your body or the baby's body or the elderly person's body and be in front of a fan. Because the fastest way to get your body temperature down is just basically get wet and then evaporate that water off of you by a fan, and that will really keep your body temperature down. Another thing that I think would be very important is to make sure you're hydrated, both the kids and the elderly people, and you're hydrating with electrolytes because you're going to be like super sweaty, you're going to be losing a lot of electrolytes, and just water sometimes isn't enough. And if anyone shows signs of being super red, their level of consciousness is dropping, they're very, very sweaty, they're not around, like they're not really responding to you in the same way, then those are the initial signs of heat exhaustion.
For electrolytes, would you recommend, do it yourself
You could.
concoction, or do you recommend supplements?
You could do both. You could like get like the electrolyte solutions. There are multiple different ones in the market. You could just buy one and mix it with water and have that. A natural option would be to get coconut water and then you add just a little bit of salt to it, and that's basically electrolytes.
Brilliant.
Yeah.
And in terms of essentials that you should have at home,
Yeah.
what are the medical kit essentials to be prepared for such situations?
Okay, so first aid kit. First aid kit would have bandages, betadine or alcohol swabs or any antiseptic swabs, sterile gauze, scissor, tweezers, basic pain management like paracetamol. If you have anyone majorly sick, have like prescription meds available in the first aid kit, then definitely have that on hand as well.
So if you were to inform our audience, what is a simple first aid kind of action plan that they could do with limited resources?
I would recommend everyone get like do a first aid course. That would be super helpful. There are BLS courses, there are first aid courses that can teach you a lot. But simple things that you can do. If there's a bleed, put a compression. So whatever's bleeding, just put pressure on it.
Okay.
That will stop the bleed. If you have someone that's passed out, then you want to put them on the left lateral position because that's the safest position for them to be on. If you have wounds, then just clean the wound, irrigate, like you get a lot of water on it, like get the dirt out, cover it with antiseptic spray, gauze. If it's major and you're concerned, head to the ER. Those are like basic things that you can do. Even if you have nothing, all you need is like a piece of cloth, some water, and betadine. That's it.
Okay, let's lighten the mood a little bit.
Sure.
What's the craziest emergency story that you could tell us?
I have a lot of crazy stories, but one, like off the top of my head, one that I recently had was I had to deliver a baby in the car. So yeah. So we had a patient that came in, and she had come in a little bit late, and her delivery was super fast. So by the time she got to the hospital, she was already in the process of delivering her baby in the car. So we didn't really have the time. Like, it's actually happening, like on the spot, it's happening. So when that's happening, you can't like stop it. It's nature. You gotta let it, take its course. So she was fantastic. I was honestly very impressed with how calm she was and how she just did everything automatically.
No way.
Uh
So,
yeah.
okay, walk us through it. You got your tools to the car?
Yes. So, I mean, I was just sitting outside having my morning coffee. It was early in the morning. It was like 5:30, 6 a.m. It was
Okay.
like the very beginning of my shift. So I was standing there having my coffee because it's usually super quiet then, watching the sunrise and,
Yeah.
chilling. And I saw a car just come by, and everyone looked panicked. And the guy got out of the car and he asked for help. So I headed to them, and I saw she was in the front seat and she was in active labor. So I just ran, got a set of gloves, got her in the right position, called the nurse to bring the tools, and we delivered the baby in the car.
No
Super
way.
healthy. She was a healthy baby, good cry. Mama did a fantastic job. We cut the cord in the car. We got her on mama's chest in the car. And yeah, then we shifted her once like we had delivered. We shifted her to the ward. The obstetrician saw her there, and she did really well. No complications. Baby was happy. Mama was happy. Family were happy. So, and we were thrilled. It was fantastic.
Insane. What a
Yeah.
story to tell.
Yeah.
And if there's one thing that you think people should focus on now in these uncertain times, what would that be?
Staying grounded, I think. Stay grounded, be with your family, keep your friends close, keep your loved ones close, and maintain a sense of community, because that's the only thing that's going to get us through all of that. Rather, yeah, just maintain community.
Thank you, Dr. Razan. I think you've kind of uh, tamed a lot of our fears
You're
in a
welcome.
very like pragmatic manner.
You're welcome. Very happy.
Thanks a lot.
You're welcome. I had a great time. Thanks.